All right, well, with many people staying close to home, more and more people are considering taking advantage of seeing their doctor via the internet. Here to tell us about some new ways to visit your dental professional is Dr. Jeffrey Sulitzer. Hello, Jeffrey.
Hi, good morning.
Thanks for joining us. We appreciate it. Let's talk a little bit about telehealth right now. It's obviously so important with everything going on with COVID-19.
It is, and telehealth is leveraging the technology that we have today in our smartphones and our laptop computers so that we're able to communicate medical conditions with our physicians, mental health conditions with mental health care workers, and dental conditions through our dentists and or orthodontists. So it's really a great platform to access care, particularly with the COVID-19 scenario going on today.
Well, I think there's so much value to that with where we're at in society at this moment. So talk a little bit about some of the value that it does bring to consumers.
Sure, it brings a level of comfort and reassurance and also confidence that they're getting care and they're not alone. So, we're being told to practice social distancing, and certainly if you think you have the symptoms of coronavirus, which is, high fever, headache, sore throat, you want to be able to stay away from other people. So if you can stay home and gather the information that you need and share that with a healthcare provider through either FaceTime or other social media such as Skype, or you can text or use any other form, maybe even email, you can communicate that information without leaving your home and putting others at risk, particularly to healthcare workers themselves.
I love that you said that. I think that's what we all have to know, is putting others at risk and health professionals at risk, that we have to be so smart. But, I think the concern with telehealth that people have is they wonder, when is a telehealth person the right choice for me? And when do I truly need to go in person to see someone? How do we discern that decision?
Yeah, sure. When it comes to the coronavirus particularly, one of the symptoms that has been prevalent is this difficulty in breathing. So if you're experiencing difficulty in breathing, you want to go to your healthcare provider in person as soon as you can. And that's either your primary care physician, it could be an urgent care, or it could be even going to the hospital if it's that bad, the emergency room. However, if you have the other symptoms, which we're hearing about as well, which is again the high fever, headache, sore throat, then that can be managed through a telehealth or a telemedical experience. So we would recommend that you do that first and see if you can get direction as to what to do, and let the healthcare provider what the next steps would be to let you know what you need to do from that point on.
Well, I like that you're going to have directions for your next steps. So kind of walk us through what a telehealth experience would be like, because a lot of us think about the intake experience when we see our doctor in person, and I think we're afraid of the differences. So how does it really play out when you seek out a telehealth professional?
Actually, the telehealth experience is really no different than the in-person experience that we've all had in our past and currently. You're going to share your symptoms, the history of those symptoms, the severity of those symptoms through that medium. And it could be through, again, Skype, it could be through voice, it could be through FaceTime. So you're really still being able to share the information because the technology is so good, it's no different. So you should feel comfortable and secure that you can share that information, and then let that professional decide what the next step should be. But it's really a very similar experience, except you're not exposing others to that problem that you have. And not only that, but it's also more convenient for you, and you don't have to leave your home because you're sick and you don't feel that well anyway. You don't have to get in a car and drive over or walk to a healthcare provider.
And isn't that the truth? So many of us wait so long because we don't feel good, we don't want to leave the house, and then oftentimes we've waited too long. I do want you to address teledentistry, because so many of us say, how does that work? How is that coming on the forefront?
No, that's a great question. Teledentistry is growing in leaps and bounds. We can do triage for dental pain, dental concerns, even broken teeth, at least to get an understanding of what we need to do, and we can direct you to the right care. And we can also do orthodontics. The company I work for, SmileDirectClub, we do invisible clear aligners through a telehealth platform. So the opportunities are growing vastly as to the capabilities of what telehealth, telemedicine, particularly teledentistry and telemental health can bring to you as a consumer, you as a patient.
The experiences are so innovative, and I think they're truly going to serve us on a whole new level. And so I appreciate you chatting with us today, Doctor. Thank you.
Thank you. It was a pleasure.
The website so you can learn more about teledentistry is SmileDirectClub.com.